essentially what People+ai does, we're a not-for-profit that's focused on figuring out what types of AI solutions work. And the ones that do work, we publish basically the GitHub repository and all the code in the form of an open prototype saying this works and everyone should adopt it. The ones that don't work, unfortunately, we then say this is why it didn't work. So if anyone is now trying it, don't fall into the same mistakes that we made. And what we're hoping to do is basically reduce the cost of innovating in the AI space, because AI is already expensive enough, building models is expensive enough. And while there are a lot of capabilities out there, what there's often a lack of is creativity. So there are tons of LLM capabilities to actually creatively figure out what will work, what won't work, and then put another lens of what will work at a population scale like India. And so we work a little bit like an R&D lab that goes across domains, problem statements, and tests out solutions. As of now, this is where we're at. A lot of our ideas and things that we do is crowdsourced. So we have people from within our community. What's the latest count? About 2,500? Yeah, so we have about 2,500 community members. Many of them are tech and social impact enthusiasts working across India that regularly send ideas of different, AI use cases and solutions. And so what we do is we crowdsource these ideas, we vet them so that it's, curated, and then we get volunteers to actually build out these ideas and make it come to life. So say, for example, if Vaibhav has a great AI use case idea and it's difficult for Vaibhav to work on it alone, he can then bring it to a community like this, at events like this, find 5 other volunteers that have skill sets that he doesn't have to work alongside him, and hopefully in a period of 3 months reach a conclusion of whether it's likely to work, and if it were to work, what would be I usually call it the recipe for it to work, and if it's not working, publish all the learnings why. So if you go to the People+ai website, right here on our website, we have what's called as a wiki, which is basically our thesis, and we publish we believe in open source information. So along with most of our code and all the solutions that we build out, we also publish the thesis and the learnings from that thesis. So whatever problem statement we're looking to validate, we publish those problem statements, and they're all and we categorize it according to various segments. So our thesis for startups in the compute space, models and data, upskilling and talent, use case areas or development areas, society areas. Society areas is often related to policy, regulation, that type of thing. And along with our thesis, we have our open projects, which basically are now active working groups. So these are ideas that are vetted, refined, and now actually being built upon. Here's my favorite one, which is this. And at every event like this, I'm hoping to get a few more ideas that are high quality. So the reason why I'm showing you this is these are not ideas that we come up with. These are ideas that you guys come up with. And what we try to do as an organization is to provide you all the resources, knowledge, manpower, free of cost, to work on these ideas. And that's why we say we're a community and we're a volunteer-led movement. We have, I think, back on the presentation, about 198 active volunteers, about 25 groups. And so if you're looking to start ideas, test it out. I know we're all here and we're going to be looking at mental health AI use cases. So if you have certain ideas in that space, and you're willing to share it, if it's something that's patented, closed source, everyone has to sign an NDA before having a conversation with you, this might not be the best place. But if it's open source and you're willing to at least talk about it, share the idea, tinker with it, experiment with it, you might find that this community is the right fit. Many entrepreneurs have now found co-founders right here. So that being said, welcome to the AI mental health event. I'm going to hand it over to Love and Tanisha that will be running the agenda for today. The good news about events like this on a Thursday evening and even Friday evenings is that it's quite hard to get a cab in Koramangala in the evening. So while you wait to get a cab after the event, at least stay for some food and drinks and make a friend. Don't go without making a friend, because the hope is not that we get some ideas, we'll get some learnings. That's going to happen anyway. But hopefully you'll connect with a few people where you can actually develop those ideas and make it come to life. And that's our hope for today. So over to Love and Tanisha.
So, coming to Sukoon, the way that I like to describe it is that it's an AI-enabled ecosystem approach to addressing India's mental health gaps. And I know that's a mouthful, so as we go through the slides, hopefully I'll break down each and every component for you. And so the genesis for the idea of Sukoon came from a deeply personal place. I was actually working abroad, and I was doing an extremely demanding job, investment banking. I don't know if there are any bankers in the room. And there would be these periods where I would experience extreme bouts of anxiety. And typically in those types of situations, you could call a friend or a family member and talk to them about your situation. But it's not always the case that they're always going to be available. And I feel like in those extremely vulnerable states, if they didn't answer my phone call, it almost felt like a personal rejection. And this was around the time when ChatGPT was released. So I started talking to ChatGPT, and what I thought it did a really good job at was helping me be introspective about my own situation and providing this unbiased response as to how, if I was on the brink of an extremely negative spiral, how I could pull myself out of that. And that's when I thought that wouldn't it be wonderful if this type of a tool could be available and accessible by everyone, and if we can even incrementally improve the state of mental health in our ecosystem, it could translate into having such a large impact. So that's when Love and I began speaking about Sukoon.
Sukoon is our effort to actually see mental health is an invisible pandemic. A lot of people have it, but they don't talk about it. They don't reach out for help. And even when they reach out to help, there is accessibility issue, affordability issue. Like even in my personal life, being from an IIT, I know that despite getting that tag, there is a lot of pressure, both even during the studies when you're preparing for it and off it, to perform to societal expectations. And it brings a lot of mental health issues which just gets under the rug. We wanted to do something that can we do leverage technology in a way which can empower those people, like provide them maybe some help to one who is just like going down a negative spiral. So yeah.
And so when it comes to building solutions for our country, I think it's really important to get incentive alignment between three key stakeholders, which is your Samaj, Sarkar and Bazaar. So of course this is a Sarkar problem because less than 1% of the healthcare budget actually goes towards mental health care. It's a Samaj problem because almost 50 million children in India grapple with mental health issues, and 15 crore Indians need mental health care, but less than a fifth of them receive it. And it's also a Bazaar issue because the projected economic loss stands at 1 trillion between 2017 to 2030 as projected by the World Health Organization. And so what we're really trying to do at Sukoon is understanding the various stakeholders that exist in our mental health ecosystem and designing solutions for the problems that they face today. So it really becomes a capacity building exercise. So these stakeholders can be divided into three categories. You have your common users like you and me, you have your frontline workers, and then of course your mental health care practitioners in the form of therapists, psychologists, psychiatrists. So when it comes to common users, you can build a tool that maybe helps you better manage your stress or your anxiety. You could possibly build a tool for a caregiver, and what that means is if my mother has been diagnosed with chronic anxiety, I might not necessarily know what to do when she is having a panic attack, but by using this tool, I could get the educational resources at my fingertips in terms of how I should talk to her about whatever she's going through. Then of course you have your frontline workers. So as Love and I was speaking to various stakeholders within the mental health ecosystem, a lot of non-profits, the way that they do upskilling currently is by organizing workshops, maybe a 3-day in-person workshop every 2 or 3 months, and then trying to give whatever educational resources, best practices, information there is to the frontline workers in that area. But what if there was an AI-enabled coach, for example? So when a frontline worker was facing a situation that they haven't encountered before, they could talk about it and get the best response as to how they should handle the particular situation. And then of course you have tools for your practitioners. So I know there are quite a few therapists in this room, which I'm excited about. And one of the biggest problems, that we've come across through conversations is clinical documentation. I think that exists across the board of healthcare. So typically when you go to meet your therapist, you will be in a 15-minute conversation with them. Then they'll spend those remaining 10 minutes to quickly jot down notes, because if they're taking notes during the time of the conversation, the client or patient might feel like, my therapist is distracted and not paying attention to me. So we can possibly use speech-to-text tools to completely automate this process. Then using AI to generate case summaries. So there's a whole suite of use cases that can be built leveraging AI. And tying back to our broader thesis at People+, which is that AI won't change the world, but people with AI will. So when we try to talk about Sukoon to an individual who's not familiar with the project, their immediate reaction is, oh, are you trying to replace therapists? That is not at all what we are trying to do. What we're trying to do is augment the process of care delivery. And so what this means, if you look at this spectrum of where mental health issues might fall, we play in the blue dashed rectangle, which is in the self-management and content area, as well as the mild cases of anxiety, stress, loneliness, where you might not necessarily need to seek the help of a professional therapist. And then of course, if it is the case where you do need that human intervention, we're trying to build in triaging pathways into our solutions so that you can seek those.
So just I wanted to add here. In India, we have only 9,000 therapists. These are the data, and we have a population of 140 crore. So clearly there is a huge demand gap in terms of providing the support. So our idea was AI-like technology. What are the gaps in the current system in which we can use AI to effectively scale without replacing therapy? So let's say you have an example, bad day at work, but you won't go to a therapist, right? You won't go because you will think, okay, just one bad day, but you might need support. So how do we use a AI-like solution to provide support in those scenarios where you will not go to a therapist anyway, but now you have a tool which empowers you to do that. So basically we are just enabling people to have more support than before with AI. So for Sukoon, initially when we were doing user research, we thought which is the target group we should be building for. We came across very high stress groups in India, let's say working professionals, moms, police, healthcare workers itself. Then we realized that based on our survey results also, that the group most impressionable is the student group. We have a very fairly young population, like half of our population is under 30, and they are also very tech savvy. So it adds to both the dimension of need as well as adoption. That's why we decided, why don't we focus on student groups which are going to be the future of India. And based on results, if you see, this survey, we had 600 students participating from IIT Kanpur, where we are rolling out our solution. 1/4 of them, they used ChatGPT-like solutions currently, which is not designed for therapy, but still they use it for their anxiety management. The reason they do that is clearly showing there is a great demand for it. Like people want some kind of support, but when they don't get it, they're just using a generalized what AI tools they are getting, and 1/3 of them at some point tried to seeking professional help, but only 3% of actually got it. So it adds to the previous point I was making: accessibility, affordability, stigma, like being the major barriers.
So now I think for the exciting bit in our presentation, we're going to show you a demo of the Sukoon chatbot.
नमस्ते, मैं समझता हूँ कि आप कल की अपनी परीक्षा को लेकर डरे हुए हैं। यह एक आम भावना है जो कई छात्रों को होती है। क्या आप मुझे बता सकते हैं कि इस परीक्षा को लेकर आपको सबसे ज्यादा क्या चिंता है? इस बातचीत को जारी रखते हुए आप स्वीकार करते हैं कि आप आई सिस्टम के साथ बातचीत करने के लिए अपनी सूचित सहमति देते हैं।
मैं अगर फेल हो जाऊंगा तो मेरे मम्मी पापा मुझसे बहुत नाराज रहेंगे। मुझे लगता है मैं लेट कर सकता हूँ।
ऐसा लगता है कि आप अपने माता पिता की अपेक्षाओं को पूरा करने के लिए बहुत दबाव महसूस कर रहे हैं। क्या आपने उनसे अपनी भावनाओं के बारे में बात करने पर विचार किया है? कभी कभी दूसरों को निराश करने के बारे में हमारा डर वास्तविकता से भी बदतर हो सकता है। आपको क्या लगता है कि अगर आप अपनी चिंताओं को उनके साथ साझा करते हैं तो क्या हो सकता है?
मेरी मम्मी पापा नहीं समझेंगे। मुझे किसी तरह एग्जाम में अच्छा परफॉर्म करना है, बट मुझे लगता है मैं नहीं कर पाऊँ। मुझे लगता है मैं बहुत बड़ा फेलियर हूँ।
मैं आपकी अपेक्षाओं को पूरा न कर पाने की चिंता को सुन रहा हूँ। जब आप असमर्थ महसूस करते हैं तो ये कठिन होता है। क्या आपने इन चिंताजनक विचारों को प्रबंधित करने में मदद करने के लिए कोई विश्राम तकनीक आजमाई है? कभी कभी कुछ गहरी सांसें लेने से आपका मन शांत हो सकता है और तनाव कम हो सकता है। आप क्या सोचते हैं?
So this is this one flow we have run. I think one thing which is clear in the Hindi is pretty
Bookish. Okay, it's not colloquial like the way we speak, but the thing we are saying that when a student is in stress or they need help, they can go to it like in an anonymous way, share their feelings. And right now it's designed not to be informational in the sense that it will give you, okay, you can do this, more to be conversational. You can just vent out your feelings, just share, and have the bot listen to you, because sometimes just someone listening on the other side is also helpful.
So for our initial feedback, when we built the V1 of our prototype, we rolled it out to our volunteer community. So it was tested by almost 75 volunteers, and they gave us feedback, and then we accordingly made changes to V2 of the bot, which is what we're currently working on. And so for our testing plan moving forward, we have human evaluators in the form of actual licensed therapists, and then we're also using AI as an evaluator. So once we start seeing alignment between the LLM's responses and human responses, we can start relying on using the LLM as a proxy for future feature development.
Yeah.
I know there are lots of technologists in the room, so Love's gonna go deep into that.
So for Sukoon, we are using the AI agentic architecture. This one's the basic architecture we are following. It has 3 agents, which is built on top of LangGraph. The first agent is the router agent, which routes based on the user input that which agent it needs to call. If it's a severe case, let's say it's a suicide related case, the suicide prevention agent will be called, and it will do a QPR. QPR is a de-escalation technique like CPR you have, which is sort of solves the situation till it is connected to a human professional. So it will provide you helpline numbers and future. It will also connect the person who's talking to that professional, and till the time it will do de-escalation. If it is let's say conversational, which requires conversation, a person wants to vent out their feelings, in that case it will engage in a conversation, give them space to express themselves. give them some nudges and let them open up. It is also provided with RAG, where we are using Llama Index to fetch the documents we have supplied. If some practical information is asked, then it will fetch that information from the database and provide the user with the relevant information. Yeah. As you know that if you cannot measure something, you cannot improve. So it was very imperative for us not to just build the bot, but also see how it's responding, how we are building the evaluation. For that, we are approaching it two ways. One is human evaluation. We are having our team therapists test it out, give us feedback, and also AI evaluation. So the way AI evaluation work is that for every user query and the Sukoon response, it will classify what is the primary concern which was being talked about, what was the subject category, and what was the emotional tone. Then it will also rate between 1 to 5 among, for the 4 criteria which have given: empathy, relevance, clarity, and helpfulness. I know some people will have like, okay, LLM as a judge, how good that is, and I do have the same, I shared that doubts with you. But at scale, we have thought that having LLM as a judge model will give us some scalable insight for generating like which are the particularly responses which were not good or which actually missed the point which the user was talking about completely. Also for empathy, let's say we are also using deep learning libraries, open source deep learning libraries, which are pretty built for this specific use case, and we are also exploring some alternate solutions to building our evals pipeline.
And so now, Sukoon has been tested out on the field, and so I'm going to introduce one of our volunteers, Shashwat, to talk briefly about that.
Hi, so Micah is essentially a collaboration that came into being because People+ai developed a societal platform technology which is replicable, scalable, configurable. And when Parivartan, which is a legacy mental health organization under Narendra Bulkar, figured out that this is something they can use to sort of take mental health solutions to the entire stakeholders in the rural economy, which could be your ASHA workers, healthcare delivery partners, it could be other NGOs, other social impact organizations, it could be your actual doctors, but also actual patients and their caregivers in the family. They sort of took the same architecture, developed a societal platform where we actually rolled out our Sukoon chatbot. And we are also sort of implementing an efficacy study process where this will be tested on the ground for local colloquial relevance, because this will be rolled out immediately in Assam and Maharashtra. We expect over 1 lakh people to try it within the next 6 months. And once it is also tested out for students, which is a project we are also working on with Physics Wala on the side, there will be an immediate rollout in rural economy to 20 lakh students as and when we decide to launch it. So as you can see, the Sukoon itself is not a chatbot project. We want to develop different kinds of solutions for different kinds of stakeholders. This sort of modular architecture allows to plug and play capabilities for different stakeholders as and when required, which is the goal to sort of take our solutions to Bharat in a multilingual approach, where a DPG is free to use and free to adapt across different contexts and geographies.
And so, today's meetup was focused on being informative to tell you what our progress has been since we first initiated and conceptualized Sukoon. And there's really a place for everyone who's interested in the project and wants to come join and volunteer with us. So whether you're a therapist, an educator, someone who belongs in the corporate world and could see Sukoon being implemented within your organization, please get involved, come talk to us about the problems that you're facing. The principles of this project is really co-designing solutions with other stakeholders and collaborators. Everything we do is open source, and what we're trying to do is really build these horizontal pieces of technology that can be leveraged by for-profits and enterprises for their own use cases.
So we need your help, like definitely from even a data perspective, like we are trying to source data, to the building perspective, to distribution, everywhere. Since we are open source, we are reliant on partners like you who can come and like co-create the solution with us, so we can scale at national level.
And now we'll just briefly open up for a couple of Q&A.
My name is Tavishi. I work as a product manager at a diabetes management company that works in India and in the GCC. We service a lot of customers in tier 2, tier 3 cities as well in India. as part of one of the initiatives that we're doing, we've been trying to build a AI chatbot that can help as like a virtual coach for people and service them in like multiple languages, which is basically what you guys are also doing, right? So I wanted to understand that with this is like primarily focused on mental health, right? For diabetes care, for example, along with helping people with mental health, there's an aspect of, say, informing them, the chatbot being more informed about diabetes as a condition. So as of now, since you guys are also trying to do this as a plug and play, right, is there any sort of capability of adding things on top of it where the chatbot can get more informed about a particular thing, like how you did it contextually for suicide management specifically? Is that something that's currently possible? Have you guys thought about it? What do you want to think about it?
For diabetes specifically, if you want to build, what it will take, you will have a different agent specialized with maybe different tools, a database where you will give all the information you want your AI chatbot to know. And then the flow will be like you can plug and play. You can bring in different agents, and the router will be just like it will, based on its reasoning, determine, okay, this in this situation I need to call this agent. So yeah, you can like integrate that. So that is very possible.
Through RAG-based systems.
Yeah, well, let's more.
Maybe give a lecture on that, then maybe fit the time.
Okay. Hi, I'm Dr. Paridhi Mehra. I am founder of Happinest. So as the name suggests, I am into family mental health with a focus on perinatal mental health, basically maternal mental health, pregnancy, postpartum depression and stuff. So the reason I'm here is I am trying to build something very similar, because for mothers, for new parents, therapy is not the first choice of support. Like Lav also mentioned, that if it's a bad day, for instance, for a normal person, they don't really go to the therapist, right? So even for mothers, they are stretched, on time. They do not really have the luxury of going out and having therapy sessions. So there has to be some first point of support for them, and that's what I'm trying to build with the use of LLM and AI. So my question is on the, the way you've designed it. One is which LLM you've used, what kind of training. For instance, you mentioned that it is for college students. So what kind of training has gone into it? Is it, a more prompt-based thing, or have you trained the model for that particular use case? And then what are the different kind of guardrails you have put in place to make sure that it is safe for, use at that scale?
Okay, so 3 questions. First of all, how the training has happened, what are the guardrails, and
LLM, which
for the LLM.
Yeah.
So LLM right now here is like you can switch between Llama and Claude. So those are the 2 models, Llama being open source, Claude being closed source. In terms of training, we had looked at the training data, therapist conversation like data, but most of that data is in Western context. So we were like, we reached out to different partners, like 15 plus partners, to get that in Indian setting, like in Indian context, and we are in process of doing that. So training in the sense like fine-tuning model, we have not gone down that route right now, because like even I was reading some research papers, like fine-tuning does not actually make your model like that better unless the source data is very high quality. So right now it's a mixture of prompt engineering for each individual agent, and with some RAG which we have supplied it with the source documents. So, and in terms of guardrails, the major the major thing we wanted to solve was that it should not answer questions which are outside the scope of mental health. Because that's the most high frequency thing we saw. Like when user goes, they can talk about anything. Right, but we don't want that. We want it very constrained. So for that, we have put some guardrails, and also sometimes like for the other stuff, you can use the moderation thing which is already provided. So those guardrails are there. It's not 100% foolproof, but mostly it covers the cases. Like if you go outside, it will just gently veer you back to the mental health use case.
Do you have a psychiatrist on board? So I worked in a medical college for 15 years, and for medical student first year, they offer a mentorship, buddy plus mentorship kind of support. And these mentors, they were professors actually, MD and above. And they were told that anytime you come across any mental health thing, you're not supposed to do anything. You need to refer. So MD medicine or MS guys, they are told that you are not supposed to treat any mental health condition actually. So that's why I'm asking. And other thing is, from a technology point of view, or other same experience extrapolating here, psychiatrists they keep their file only to themselves actually. Like a patient and a doctor, the files are kept only to them in their cabin. So in this regard, what all things probably we can work out, because I know it is not a straightforward kind of answer actually.
Right. So we do have multiple doctors that are volunteering with us at the moment. We're also in the process of hiring actual therapists to do the evaluation more strictly. And the efficacy testing programs that we do want to implement in Maharashtra and Assam will be done by Sangat, hopefully, who have a lot of experience in efficacy testing for digital tools in the mental health ecosystem approaches, right? And to answer your questions around privacy, any project that is developed at People+ai is seeking to be GDPR compliant while waiting for DPDP to come in, right? So absolutely, I think that's something that goes into mind when we're designing any project whatsoever, that is one of the central principles. For privacy will be the central principles, and for something especially as sensitive as mental health, that's one of the first questions is asked of us. So we have taken that into account, and technically I think Love can answer more as to how we can do that. We do face challenges. If it was to be done on WhatsApp, there is an encryption issue there. So that is a problem that we know we will face, but we will do the best we can there.
I think if you are working with Sangat, it is sealed actually. So yeah.
But I think the second part of your question, first we need to digitize the data before we can even anonymize it.
Yeah.
Hi people, my name is Gopi. I'm a fellow here at People+ai. So I'm working on multiple projects in health and accessibility. So what I'm going to present today is an accessibility project we are working on called Sunva. So Sunva means hear, listen, respond, and then respond. For responding you need to listen. So Sunva is basically, we are trying to help the deaf community in India to listen and respond. So I'm a partially deaf person. Fortunately, I hope that my speech is kind of okay and everybody here understand it. But a lot of people who have deafness in different level, they have speech issues as well. So we all speak different languages, and even in events like this, we speak English. So language is our mode of communication, and a lot of deaf people don't have access to events like this, one-to-one conversations and education and a lot of these things because they lack communication. There is a communication gap. So we are trying to solve this with the large language models, latest advancements in text-to-speech, speech-to-text and all. So without so much ado, I will first show you a demo and then we can talk about the problems in detail.
Can you do the audio?
Can you do something?
And then go back to the person. So for example, you can say some things that have technical or problem. Let's see what will happen. TensorFlow is a machine library. This library can be used for training neural network model and testing neural network model. And this library has a technique here some important keywords are highlighted. So I'm just using this tool, understand what's content there, and then go back to the content. Now let's take up some other scenario and interesting characters. Hey David, I'm from this scenario focus of nearby alone. Can we go there and discuss the issue of market? Here instead of highlighting important keywords, this is just to summarize the sentence. So what will happen is we are saying something casual and all. It will simplify the text. Simply just go to easy to understand and then go back to the content. But when it comes to some complex technical or very advanced concepts part, it will highlight important keywords. So these are just the two scenarios. First we are going to test with our deaf volunteers and then we will go back to, we will test their feedback, and then based on their feedback, we will improve the capability or come up with a new MLM level filter that can improve their quantitative understanding and what is that. Another thing we added is that we have a where we can try to consider how you so we will use it by deaf people who have turbulence. So one is kind of okay, but a person with a higher level of deafness will have a turbulence. In this case, they can use this one. So we are trying to improve something. One of the areas we are working.
Sorry for the audio, but basically what we are trying to do. So I will explain from here. So basically there are around 65 million deaf people in India, and this the place where we can go. Like there are not much information available via census about how many of these people understand language, how many of them use something like sign language. And in Google, when we searched, we found that around some 5% of deaf kids are getting proper education. I'm not even sure that is correct or not, because in India we don't have that kind of census. So apart from that, there are 65 million deaf people, and communication is very important. Not just online, but attending physical events, going to one-to-one meetings, talking to people. These are all important. And so and we have some solutions available. One is every mobile phone right now have this automatic speech recognition capabilities, and in Google Meet and all you can see live transcription. But the problem we found out is that these applications just dump the whole transcriptions, and there's a third way it will cause some fatigue. So for example, this will keep putting the transcription. For example, a person like me, I speak a lot, and you have to put a lot of effort focusing on what is written, and then I need to talk. And the second thing is when there's a TV screen or a presentation happening here, the problem is I need to look at the transcription, I need to go back to the screen, and then I need to go back to my face. So that's very annoying. And the second part is these people who have speech issues. They one way they how they do is they try to speak, but some people it's still not. The normal hearing people, for them it's very hard to understand, and then these people have vocabulary issues. So now compared to last 2-3 years, we have better text-to-speech models. So this capability I have shown here, basically take the text and show you the speech. Play you the audio. But we are going one more layer where you don't have to type the full sentence, a partial sentence, and the LLM will expand it and then put it out. So this speech to text, then LLM, then to text to speech. We are building this loop in real time with multiple languages. So we are working on other language models now. And then we have around 5 to 10 deaf volunteers now. So what we are doing is we are taking this to them, test it with them, and based on their feedback, we are trying to improve. So eventually, we'll be putting out a few things. One, this demo, obviously. The second is our Sunva API that can be integrated to multiple platforms. Like say, in some schools or colleges, they can integrate in their presentation system. So one problem I faced when I was in school was the teacher will walk and speak, and the students have to write notes. And for me, when a person is moving, I was not able to understand properly. So in areas like this will be huge use. And in some places where you are going for an interview or a casual date or meeting a friend, you can just put the phone in front of you, and then with the simplification and highlighting part, you don't have to all the time. You don't have to look at the screen. You can switch your gaze then and now, understand what's written there, come back and then speak to the person, looking at the person, grabbing what their expressions and all. So eventually, like we will expand that speech to text to speech part. So you don't have to type a lot of things. So that based on the previous conversation, we will expand it, and then the system will speak for you. And now the text to speech models are getting better and better, where you can even put expressions. So the LLM will generate expressions, so your voice will be more expressive, like sad, happy, or more empathetic. Can you? So yeah, this is what I explained. And if you're, so basically, what we are trying to do is reduce the time a deaf person takes to understand what the other person is talking by simplifying, highlighting, and other kind of LLM filters, and then reducing the time again for typing, and then speaking via machine. So obviously we need a lot of help. This is still a work in progress. So if you are a tech person with expertise in GenAI, Python, QA, prototyping, please join us for volunteering with us. Our code base and everything are open source, and we are looking for people to contribute in our code base and working with us. And if you have expertise in working with deaf people, if you're part of a school or an organization helping people who need accessibility to learn and become better, please join us. We need your feedback. We need you to help us test this prototype out and iterate quickly so that we can put it out. And then we are looking for market partners. We have few market partners, like there's one startup called Neosapien. They have a device which is basically a productivity device that will listen to your meetings and then take notes, intelligent notes, so that you can go through it later. You don't have to write it and all. So we are working with them to integrate Sunva to Neosapien, so that the deaf person can use. I mean, your mobile phone might not have a better microphone or speaker, but this Neosapien device have. So the quality will be better and better. And we are trying to expand it to learning applications and other platforms. So if you have a startup or product where you can add Sunva as an accessibility layer, you're more than welcome. We would like to collaborate with you and then integrate Sunva to your system. So thank you. That's all. If you have questions, please. We're happy to get your questions and thoughts.
Hey, thanks. This is fantastic. I have a bunch of questions, but I'll just start from here. So I feel like this can be extremely powerful for all sorts of accessibility needs as well. Do you think so? Like, for example, we have applications like JAWS, etc., which people with accessibility issues, they read out the text on the screen, the screen readers, etc. Yeah. And that's kind of a major requirement for pretty much all the products, anything which is sold in B2B.
Yeah.
Do you think this can help over there? Because this may actually reduce one part of it, converting STT. That part it will be removing, and the TTS part is what it will use.
Yeah.
And if you are supporting other languages for TTS other than English, it'll be pretty huge in accessibility. So is that something you have been thinking about?
Yeah. So interesting thing I learned from my experience. So as a tech savvy, I try out every products that come out in the market. So one thing I figured out is that many products we build focusing on accessibility can be used for other purpose. I mean, general people's purpose. So that's one interesting accessible aspect about accessibility products. And so our API we are building in maximum abstract level. Like, I mean, the end demo product we have is a continuous loop, but everything is a separate API. So like you said, it can be integrated in a flexible manner. Like, I mean, some parties can take some part of the loop and then integrate it in there. So eventually, this should be integrated as like the market partner who is integrating this should have maximum flexibility so that they can make changes. But again, based on so we are doing this in a lean methodology. Like, we build a basic prototype, take it to the volunteers and take the feedback. So why we are doing that is this feedback is very important, because if you check the market, you will see a ton of accessibility products, but not sure how many of them are actually useful. So our API will be like, I mean, maximum abstract, but again with that, we will put some specifications. Like, I mean, this is the metrics we used and we studied, and this is how we learned. Okay, just so for example, if we are seeing there's some delay in the transcription, so we purposefully put it there because I mean, for a person to read it, come back from you to the transcription scene, there should be some delay. If the transcription delay latency is like, say for example, less than some millisecond, that will cause again cause the fatigue, and that won't be useful. So we are trying to figure out how we can at the same time make the APIs abstract, but at the same time can we put some specs out there so that we can say, hey, implement this in this way so that the person can actually use, or otherwise give the control to the user so they can adjust it based on their need. So eventually, yeah, like you said, we want to expand it to that kind of areas.
Yeah. Any particular reason why we are so focused on the API-based thing and not making it local? Like Whisper, for example, started off as an API thing, but when it was converted to CPP, I mean, it takes care of all those network connectivity issues, and it's pretty fast, right? The latency, half of it, I would say, would come from the API calls. No?
So I told you, like, I mean, we need to start prototyping and testing it fast. So that's the only reason why we are doing APIs. So eventually we will move to models so that it can happen on device. So that will do a lot of privacy. Yeah.
So hi everyone, I'm here to talk about SoulUp. This is something that we've been building over the last 2 years plus. I mean, obviously the larger idea is to kind of talk about how we plan to integrate AI. It's very interesting why I think I'm basically a data scientist myself. I was working at Healthify and heading their AI for 5 years. But ever since we started building SoulUp, I've not got the chance to use AI at all. Because mental health, if you talk about it, there's a lot of unlearning that you need to do when it comes to AI, and you have to obviously be super careful in how you use it. So not started using it yet, but very excited to understand how we can partner with Sukoon later. So I'll just take you through what we are building and happy to answer questions, of course. So again, I know we've spoken about it and everybody looks at mental illness differently, or mental health, differently. But before we talk about the scope for AI, we need to first constantly define what we are trying to solve. At SoulUp, we look at mental health I think a lot of people are very over-indexed on mental illness. I mean, I know Tanisha said that you're not looking at the serious cases at all, because most of us are actually dealing with real life challenges every day. Mental illness is a small subset. And while that is very important, people who are dealing with daily challenges, which we kind of put on the back burner constantly, is where we think the largest scope of the market really lies. So here's where the problem starts, or why mental health is phenomenally interesting and extremely challenging. 3 things. One is all of us are dealing with different kinds of challenges. There is no linearity. It is highly multidimensional. Nobody can say, oh, I have anxiety. Your anxiety is linked to work. Your work is linked to relationships. Everything is multidimensional. There is no slotted way of what you might be going through. The other problem, so for instance, I'll take you through examples. You might be dealing with the porn addiction. You might be dealing with grief, social anxiety. You might have just gotten diagnosed with breast cancer. All of these are mental health issues. All of them are, but are rarely recognized as one. Now, the other bit is the needs and readiness of people to adopt any solution in mental health adds a huge layer of complexity. So, for instance, you might have people who are cost sensitive. You might have people who are stigma sensitive. You might have people who don't know if they have a problem. Then they don't know if that problem needs solving. If they know the problem needs solving, they don't know how to start solving. What solution is the best? I mean, there's just layers and layers of needs and levels of readiness. Sometimes they say, oh no, I feel I feel like the therapist doesn't work for me. Sometimes they want to talk to other people about it. So it's like multiple things work for one person at any different points of time, and different things work for different people, obviously. And the last, and obviously very typical to mental health and very different from other areas of concern, is that most people feel like they are very alone in their journey. That's the biggest confounding factor in mental health, which is why we need to use AI, very carefully, because that loneliness or sense of dealing with it alone exacerbates the problem hugely. So there are these three factors that we look at. So what are we saying? We're seeing different kinds of challenges. All are multidimensional. We're looking at different kinds of needs and readiness in terms of adopting or understanding what the problem is. And then there is this constant sense of, oh, my problem is unique. Oh, I'm dealing with this alone. Oh, nobody will get me. So all of this, it's like a motley of a lot of use cases. So I'll first talk about how we are solving it, and then the use cases for AI, which are plentiful. Right now, what we've started working with is we're developing something which is a peer-led ecosystem for solving mental health, where we are saying that, okay, let me first define a peer. A peer is anybody who has first-hand experience of the same problem as you. That's a peer. And we use peer support all the time in our lives. We use it for professional purposes all the time. That's what we are doing here, where we say, look, I have done this. Have you done this? Or I'm trying to do this. Have you done this? Let's talk. But we rarely use it well to solve mental health issues. We rarely use it well. And that's the most intuitive thing for human beings. Oh, my mother-in-law is very toxic, or I have social anxiety, or look, I have this social media addiction, and you discover somebody else who has it and you are like, awesome, now let's talk, or I wish I could talk. So we're trying to do this, basically enabling people to solve emotional challenges by connecting them to others who have been in the same boat. And we are doing this in two ways. We are doing this through one-on-one connects, and we are doing this in group connects. So for example, if there's somebody who's dealing with a porn addiction, obviously hugely debilitating in life, legit mental health issue, what can they do? They can go to the SoulUp network, find one or two other people who've overcome it or have managed it well, speak to them one-on-one. These are people like you and me. So imagine like a LinkedIn for mental health. Right now we do it for professional reasons. Imagine like a mini LinkedIn for mental health. That's what we are building on one side. The other bit is obviously working with a therapist and in a small group to overcome your addiction. And then there could be other formats. There could be accountability groups, which are habit groups, which help you overcome addiction. It could be just so many formats of peer-led support. Our idea largely at SoulUp is to build an ecosystem of peer-led formats. Right now we've launched the one-on-one and the support group format. So the way we look at AI is definitely for mental health, there is immense need for connection, and loneliness, like I said, changes how you look at that area, space. So the future, I know I'm at People+ai, but the future for mental health is definitely more human, not less. But that being said, AI, though may not always be the end provider of support, can obviously be a huge enabler and augmenter of support. Now, how do we do this? Or what are the things that we will need help with? Anytime you're building any kind of app, or in our case, we're trying to build an ecosystem, people need to understand what to go to. Right now, it's just crazy confusing. Whenever there's a plethora of options, people don't know what to start with. So I think the first thing that we really need help with, or we are looking at doing, something that we are right now enabling through actual human beings, is the concierge, the hand-holding. Why don't you do this? Okay, tell me what's going on. What are your restrictions? What are your concerns? What do you want to solve first? What all are you facing? All of these, take them into account and then solve for the hand-holding. What do you need to go with first? Do you want to talk to one person who is not a therapist? Do you want to parallelly join a support group? Do you want to eventually go to a therapist? Or first do a diagnosis, then go to a therapist? All of these are large questions because most people, the market is fairly immature. Most people don't know where to start. The solution is later. The navigation to the solution comes first. Can I actually talk to a bot? Is that enough? Or should I actually be talking to a therapist? I'm not in a place where I should be relying on a bot. So that over and under diagnosis that people are doing themselves and do not want to do themselves can actually be outsourced to a good AI system. So like I said, AI as a concierge is something that I think we will eventually need, especially in connected ecosystems, understand concerns, understand preferences, route to a specific solution, definitely gather feedback. So there is some bit of reinforcement learning that will have to come in play. Watch out for red flags. Are some people constantly on an AI chatbot? That's a red flag. An external concierge, which is also AI based, will say, look, you've been on the chatbot every day for 5 hours. That's unhealthy. Means you need, maybe professional support. So all of these need to be factored in. Are you spending too much time on social media? Or have you had to, like in our case, have you had too many peer conversations? Means you may need a therapist, you're just shying away from it. So all of this needs to happen, and obviously reassess and repeat. Reassess and repeat. So the AI concierge is something that we hope to build and hope to understand how we can build better. That's one use case. A second use case is any kind of connect that we have. Like for instance, if you go to LinkedIn, I'm just taking that example because that's the closest it comes to that's a good analogy for us. Looking to talk to somebody, how do you route people? So within an ecosystem, each portion can be enhanced using AI. That's obvious. So for peer connect, for instance, how do you get the right people on board? Even if you're looking at creating a long list of therapists, how do you curate therapists? How do you curate it? That curation can actually be done through AI. We don't need to do it humanly. How do you train? All the training can be done. Is there a way that I can actually, a lot of times people come to us, and of course, because people don't understand therapy or peer support, can I get some kind of demo? What does that mean? It doesn't mean anything, right? People will say, okay, I want a demo. So at least the least we can do is have some kind of avatar of the therapist or the peer so that you understand their personality, their rhythm, the way they talk. That's a great enabler. We tried it and it works really well. And obviously the recommendations systems, who do you recommend them to? A lot of times also what will happen in mental health is you don't know how to start any conversation, whether you're talking to a therapist or you're talking to somebody who's ready to talk to you as a peer, you have no clue. Can I talk about this? Can I talk about this? Can I go there? You don't know what the scope is. AI can really help with giving you those conversation pointers and say, look, this is what you can start talking about, because most people have no clue. Not everybody is naturally, they just don't know the words. They don't have the vocabulary for it. So that's where AI can come in. And of course, the larger idea that we are looking at is not only finding a concierge, enhancing one, but obviously enhancing all offerings in the same way. The other bit that I thought I would want to touch upon is, like right now we are in 22 different countries, but there's a lot of bias that has started creeping in, even as because we're building this out of here. So there is immediate bias that comes in. The good news is that thankfully through AI, you can program bias out of AI. You cannot program it out of somebody like me. It's very, very hard. I've tried and it doesn't work. So here's where bias creeps in. I mean, it creeps in everywhere, but I'll tell you the three things and obviously the level of bias. Curation is obviously there is bias in curating, right? Because if I'm curating people, if I'm doing it personally, whether I curate therapists or I curate peers, I look for people with values or personalities that I value. So I look for people who talk a certain way, come from specific backgrounds, and that's not cool. Or have a certain kind of degree, that's not cool. So curation is great. That's somewhere that potential for bias creeps in. A great way to remove this bias. Obviously, ways of removing bias, we know. Training sets need to be unbiased. We need to have human intervention. We need to have human oversight. All of that. One great way of removing bias is a blind test. So we started doing blind tests that if I make one feature, maybe gender or educational qualification or anything, if I remove that feature, do I see bias creep in? So a blind test is a great way to remove bias in AI systems. So we started using the blind test to remove curation biases. I think the biggest scope and the hardest to do is assessments. Because I would love for somebody at Sukoon to try it, because most clinically approved assessments have all been clinically approved outside the country. So if I take a regular assessment, a PHQ for depression, that's not been tested enough for the Indian population. most clinical and standard tests are not done here. So it would be great if somebody can develop or retest assessments for bias. All like the assessment for depression, something like depression, which is so common, is crazy biased. Doesn't take into account comorbidities, race, gender, identity, none of that. So that's one big thing. So I think there's a lot of scope because assessments and diagnostics is like the center and the foundation of what we need to do with mental health. The other thing that we are trying to do obviously is recommendation algorithms and remove bias, and those are more standard fare where you remove whether training data and fairness algorithms need to kick in. But yeah, that's what we are trying to do.
You said like assessment is done currently out of India like that, but how and if anyone can help you in assessing, but we don't know how it is done access, because how assessment is done, because currently like we are normal only, how to find out the people who, or someone who has we know that they have some by like some or the other abnormalities or something is there, then we need to predict that, and means how your application we will test. And second thing is like so in this whole app, where will you put it, like monetization for this, means how that, because that you didn't project anyway.
Okay, so I didn't talk about SoulUp enough. First I'll go to the monetization bit. So like I mentioned, we are doing two things right now. We help you, if you go to the SoulUp website, you'll be able to find somebody else who's going through the same challenge as you. We have a universe of 700 peers who've been verified and trained by us, around 250 challenges. So if you are maybe if you are a caregiver for somebody with schizophrenia, you will be able to find other caregivers and schedule a conversation with them. All conversations are monetized. So you pay anywhere between $399 to $699 to speak with them. The other bit is support groups. So for instance, if I have ADHD, I can join a support group with 5 other people who are also trying to manage their ADHD well. And that's done with a therapist, and it's like a 12-session program. It's monetized. So we've solved the monetization. In terms of assessments, that's not part of what, that's not something that's unique to SoulUp, of course. The assessment is needed so that on 2 levels. One is it helps you introspect on what is really happening. Assessments can be to diagnose a condition, or I would say not diagnose, figure out if you may have it. And also assessments are needed to understand if something is really impacting your life. For instance, you are a caregiver. You don't know if your caregiving stress is real. You don't know that. If you have anger management, a lot of times people don't know they have anger issues. They think they do, but they are not sure, and assessment can tell you if you do have one, or you might be struggling with one. Now, in terms of knowing if we've been able to remove that bias, it's label data. It's simple label data. I mean, we know that it will definitely work well in populations which it is being used to develop on. And if we start adding information with Indians or people coming from different gender identities, if it starts to make mistakes, it starts to misfire, that means there is bias. So obviously it needs to be retrained, and questions need to be added to collect more feature sets for it to predict correctly. That's not something that we started doing, it's something that we need to do. Because assessments need to be clinically proven. It's not something that SoulUp can develop on their own. Most of these are peer-reviewed assessments that people trust. So that needs to be that needs to happen at a universal level, not something that we can do.
Question. So this is just a question in terms of the peer-to-peer conversations happening. Is there any layer of sort of say, is there anything layered on it to sort of look for red flags where the peer, even though they're trained by you, is how do you know sort of soft, very minute things can manipulate a person, right? And they don't have to be something outrightly manipulative or outrightly even wrong. But how do you do you have a system to sort of see whether the recommendations of them are objectively very good, or whether they're falling out of line with respect to what the training was? And if that exists, how is that compliant with privacy?
Yes, that's a good question, and we get this question all the time. Yeah. So Peer Connect, by definition, does only 2 things. There's this concept of lived experience in mental health, which is you sharing your experience with somebody else. Let's talk about the user first. If I want to talk to somebody who has, maybe I have postpartum depression, and I want to talk to somebody who has postpartum depression, or maybe let me look for an example which is rarer. I'm trying to adopt a child. It's very difficult. How hard it is, it's really hard for me to come across somebody who's also really trying to adopt a child. The biggest I think, highlight for a caller or a user is that they found somebody in the same boat who's done it. And they can talk about their concerns. Now, what a peer does is they share their experience. It's not an advice. It can't be advice. That's what they're trained on. They're trained to not give advice. They're trained to listen. They're trained to ask questions. And they are trained to say, look, this is what I did. Now take it with a big mountain of salt. And that's it. But it's really valuable. People still want it. You will meet people who have bipolar disorder who've never met anybody else with bipolar. And what are their concerns? Obviously, they're managing their bipolar with a therapist. They have real concerns, which only somebody living with bipolar can have. Will I ever get married? Can I date if I have bipolar? Can I be a good parent if I have bipolar? I'm pregnant and I discovered I have bipolar. So these are things that you need a lot of relatability for. And you are super happy when you discover somebody else who's a parent and has also been bipolar. So that sharing of daily coping strategies is what people care about, and they know. We tell them that, look, you're not talking to an expert. But obviously, we train peers to do these conversations mindfully. There is something called the helper effect. People are doing it to validate their own journey. Like if I go through IIT and I maybe dropped a year, I would love to talk to somebody who's dropped a year, not to manipulate them into or out of it, but it validates the fact that yes, my struggle was as real as this person's. People love that. I mean, you can call it an ego trip, but that validation is because nobody is emotionally perfect. None of us are. And when we speak to somebody else, say, oh, look, I battled cancer and let me tell you how I overcame it. It's just so, it's like this bravo moment for myself where I said, yeah, look, I did this. So we've never had reports of people manipulating. So we train them to not give advice. And if they identify red flags, that person has self-harm or, extreme emotional tendency, in a very negative emotional space, then they're trained to identify that and pass it on to us.
Thank you.
So if I understand correctly, peers are also humans, right? So, and it might be ironical because your name is SoulUp, but have you thought about having peers who are like just AI, like AI is talking to someone, helping them? Since Gen AI has made so much progress, have you thought about having an AI peer and that can help someone?
We've thought about it and discarded it for now. The reason is, like I said, that's always possible, right? You can always have it. And there are multiple reasons why we've consciously, and obviously it's very hard to tell an investor or somebody else, right? I mean, you're trying to scale that, look, this is not AI enabled. We are not offering support through AI. There is enablement and augmentation, but the end product is not AI. Why I think it may not work is one, imagine you're depressed. You have legit depression. Now imagine using AI every day, only to talk to AI. Would you prefer to do that if you knew that you could talk to a real human being? Would you do that? Out of choice, out of scale needs, yes. Out of choice, would you do it? It's a question you have to ask yourself. The other bit is, there's a lot of, and I'm sure therapists in the room will maybe agree with this, there is a lot of resilience you develop when you don't have something at your beck and call. There's a reason why therapy sessions are 1 week apart usually. If you have something at your beck and call, there is an emotional crutch that you're relying on. So maybe you're trying to solve one problem, but you'll maybe create another one in the process of solving one. And sometimes, a lot of it is information. AI can give you information. No, do this, do that. But it won't tell you why those decisions were made. If I tell you, look, I adopted a child, and there's no way that you will be able to actually ask the 5 levels of why. What were those decisions? What were those sacrifices? Because the person at the end of on the other line is AI, not a real person. You don't know their deepest motivations, their deepest disappointments, the real reasons why they made a decision. So maybe in some cases, AI can give you some quick tips or information. But when you want to really relate or understand the other person's motivations and experience, then you know that it's not a real person. So you don't want to talk to them always.
This was more related to what was asked earlier about how you're moderating this. Sure. How do you regulate whether in your peer sessions somebody is actually not giving advice, even though there are guidelines, trainings, etc. that is done? Is there some sort of like proactive regulation that you guys are doing, or are you relying on the fact that there are no complaints as of now of this?
Yes, we are definitely relying on it because it's a fine line.
Right.
And we can't record, or at least we choose not to record. At some point, we do want to get in AI moderators, like the Omni release showed that we could get AI to moderate. So the plan is to get AI moderation so that we can pick up on words which help us regulate better. That's where AI enablement or augmentation comes in. But till we do that, we are going to rely on feedback.
How do you do this peer matching? So do you curate a set of, how does that work? I did not hear much detail on that.
Yes, so we don't match automatically. There is a whole network of peers that you can match yourself to. We do recommend. It's something that since you're in the process of building this, we're also trying to understand what people do to select peers. Because if we start matching, there's no way for us to gather training data. So right now we're in the process of literally gathering training data where we say, okay, look, somebody with ADHD has come in, 24-year-old male. Let's see what peers they choose. And then we try and understand, okay, so we know that this profile chooses these kind of peers. Or this profile gets confused and has no clue what peer to choose. So we don't actively match yet. We recommend a list of 5 or 10, and then we try and see what they're choosing. It's part of our,
What about the curation?
How do we curate?
Yeah.
So right now all the curation is done by, like, we have people who curate on video one-on-one. People fill a very detailed form that, this is what their journey is, blah, all of that. It's a very detailed form. And then we have a one-on-one curation process. So we talk to you on video. If there's a diagnosed condition, we collect proof of diagnosis. We explain how the peer process works. Then you undergo training, and then you're on.
Any differences between, as you say, 22 countries, between India and others in terms of feedback?
Yeah, so in terms of feedback, no real difference. I think in terms of the kind of things that we've seen a lot of people outside India talk about family issues and mental illness. A lot of people within India talk about, again, family issues. Relationships is bigger in India. Because I think in India, a lot of people don't do much about softer aspects of their lives. They only are probably seeking help if there is a diagnosable condition. So I think we've seen topics change, but in terms of how they use this system, there's no difference. There's no real difference.
So if I go in system, I can talk anyone in the planet?
Sorry?
I can talk with anyone in the planet?
Yeah, right now, yes, you can. Technically, yes.
Yeah.
Most of our peers, like 90% of our peers are India-based. And there is cultural relevance. If I'm talking about relationships, I want to talk to somebody who understands my culture, even my ethnicity. So they want to really narrow down. Even if I speak English well, but if my mother tongue is Malayalam, I would want to talk to somebody who speaks in Malayalam. Because there is just so many overtones of culture. You will want to do that. But for some things, culturally, the relevance is lower. If I have just been diagnosed with breast cancer, I don't care. I'll maybe talk to anybody, or I'll talk to all 10 peers if there are 10 peers. So we've seen people come and talk to everybody, gather, crowd intelligence, and then see what they can do with it.
Sure. Thank you.
Do you project yourself like a mental health platform, or give us about platform? Because mental health, to narrow it down, I see it's like a super use case which can be used for anything. For instance, I may want to adopt a dog, right? That's a very simple use case, nothing to do with mental health. And I want to find out people as to how their experience has been, and I would love to pay for it.
Yeah.
Or simple use cases like that. For instance, my mother-in-law is toxic, nothing to do with mental health, but I would just want to talk to people who've, about anything and everything. And peer support is a great way to do that. So do you project yourself like a...
Yeah, so we do mental health, but we constantly tell people that all of these are also emotional decisions.
Mm-hmm.
So you will find people who are trying to maybe not adopt a dog yet, but adopt kids, or decide on whether they want to have children, or want to figure out if what they're facing is bullying. So because all of it is mental health, like I said, these are real life challenges which You may or may not think that a therapist is your first port of call, but you still are looking for inputs on and how do you get them. And some of them are also, like, therapy is so much about self-awareness, but you need both. You need self-awareness, you also need perspective, which is external perspective, and that is really helpful when you're talking to a peer. So adoption, if you talk about adoption, the therapist might be able to tell you why you feel that you need to adopt. And somebody else might tell you that, look, I did adopt and these are the things that you need to be super careful about because I did adopt a kid. And you need to be careful or be mindful of these 100 things that can go wrong and can only happen if you talk to a peer. And yes, we do what people think is peripheral but is actually mental health. Anything with an emotional thing. We didn't want to go beyond it because the moment you go beyond anything emotional, again, anything emotional starts going on the back burner. Then everybody will be like, dude, how do I become a product manager, or how do I, become this whatever. Yeah.
Something that you are comfortable, say, putting on a WhatsApp group or on Reddit or on LinkedIn. There's no qualms of putting that, hey, anybody who's adopted a dog, can you please reach out? Versus any mental health issue, you will not be comfortable putting it out. Yeah. And maybe that's the need. That's probably the differentiation.
Yeah, and also with a forum, you know that most forums can be helpful. Reddit is great, but sometimes can be fairly chaotic and non-cohesive because 100 people start sharing tangential context when you go to a forum, and you want to have that deep conversation because, like, personally we've seen people go into great depths. Like I said, they want to ask the why. Okay, you adopted, what happened? Then what happened? Why? Then what happened? You want to know those real stories. Also, another reason why an AI bot may or may not be able to do it because there is no shared experience. It's a machine at the end of the day. There is no sense of belonging that you can have with an AI system. An AI system can guide you.
Yeah. Why you want to talk to 5 people and get that perspective? There's no perspective.
So that sense of belonging is important, and that perspective, yes. Both.
This is slightly different from everything that we've been looking at today. I think we're at the stage of the day where, you've come to the Leapfrogging in healthcare event. The healthcare bit, the mental health bit is over. This is the Leapfrogging bit, I would say. One thing that I really point out and notice, and what really even happens in this place is a lot of ideas, right? All of your projects, Sukoon and Sunva, even what you're working at SoulUp, is also started off as ideas. And we think that these ideas happen when you design for inspiration. That's why this little weird story, I don't know if you're able to make out, but what I'm trying to get to is the idea of the printing press came from the wine press and coin punch. And both used pressure to basically extract juice for the wine, and the other one to imprint designs onto metal coins. And this person, Johannes, he basically got inspired and figured out that he can merge both of these ideas and create the printing press. With this came democratization of knowledge, newspapers became more prevalent, etc. And you can see here also, typefaces and lowercase and uppercase became a thing because of the printing press, because they stored uppercase in a specific area of the stamp and on the lowercase here. Same goes for the airplane, right? The Wright brothers were just really inspired by how birds used to tilt their wings to modify how much control they had. And that inspiration is really what got us aviation. And here, leading to the first successful airplane. You get your best ideas when you're inspired, and then you work on your ideas. You tinker with it, you try to fickle with it till you get to a point where these ideas can actually be live on the internet or whatnot and actually impact people, right? Around 5 months ago, when we did our first flagship event on May 7th, Nandan said that India will be the use case capital of the world. This is true, but what we've also realized, we've heard a lot of use cases here today too. I heard a few new ones come from over there, etc. And that's true, but also the thing is we can't do them alone, which is why we thought that we would work on a repository of use cases, ideas, but also what we've slowly begun to realize is that it's not just a repository of ideas, it's also a garden for inspiration. At least that's what it's looking to be, and it's meant to be a repository where you can store and dump your ideas, existing AI solutions, etc. Even if you're working on one right now, even if you've just thought of one randomly, this is a good place to dump it. And what I've seen happening, and what I'll show you a little later on, is right now we're at the populate stage of this project. This is a V0.1, so take it with a mountain of salt. But we're at the populating ideas stage right now, which is going really well. That's why we have events like this, hoping that you guys also put in your ideas into the repository. Population is going really well. Then encourage collaboration, because again, like I said, we can't do this by ourselves. We need other people to come in, look at these ideas, look at domain-specific ideas and pick up these problems. And we will hopefully be that place where you can come together and solve these problems. We will do that through more focused events through these use cases. We can pick up a use case, maybe do an event around it, maybe do a roundtable around it, get people to really work on it. We can also do working groups like some of these projects are, and pick up individual use cases. But also, we don't necessarily want to be in the middle of it. You can also pick up an idea, look at all of the other people who are interested in those use cases. Form a group yourself and work on it, right? It's out there. I mean, eventually when it gets to a V1, you should all be able to see the activity of each idea on the garden itself. Currently, you can look at these ideas, you can explore what it's about, you can get in touch with the people who thought about it, and also like potential partners and stuff like that. Second, again, like I said, we will cheerlead and support any of these ideas that are on the garden. If we think that any of these are of interest to us and also social good, AI for good, etc., that's when you pick up these ideas and we'll cheerlead and support what's happening. Here's a quick look at what the garden looks like right now. This is over the period of, I'd say like the last week-ish. This is the first time I'm sharing this with any group larger than 5 people, to be honest. But this is what we have so far. You'll see a bunch of ideas across different domains: compute, climate, health, education. We have a few that are mental health focused right over here. And just looking into what one of these things look like. It essentially has the problem statement, potential solution, the description of the problem. It also auto-calculates the expected impact, etc. Most of these are automatically filled up, by the way. Just a very few bits of information comes from the actual submitter of the idea. And here's another one that came across, which was really interesting. But yes, okay. So that's what I want to get to. This is not just a garden of use cases. This is a garden of ideas for you to pick up and hopefully submit, collaborate, and act on all of these different steps that you saw over there. Funnily enough, just yesterday, somebody reached out after seeing one of the use cases on the garden, which was submitted by the founder of a AI video editing platform sort of thing. The person who reached out to me was a person working on low-cost recruitment platform for Indian youth masses. And he was interested in that use case. What I found really interesting was that the idea was submitted by a video editing company person, and it was picked up by somebody completely unrelated because the use case was relevant for him. Yeah, it's a skill set mapping and opportunity matching thing. That's the one that got picked up. But I think it's really interesting how these collaborations can come across very naturally when you design for it. That's the hope behind the use case garden. And again, I'd rephrase and say it's an inspiration garden, but that's what we're calling it right now. But again, I'll just go back to this slide so you can, if you want to take a screenshot, but I'll also make sure that it's sent across to your emails, etc. after the event. But yeah, if you guys have any questions, ideas, etc., please feel free to ask. Amit is also here. He's one of the volunteers that worked on the idea very early on, about a year back, I'd say. But yeah, open for any questions. Otherwise, I'll just let Tanisha close. So both ways, I would say. See, the original contributor can be a part of the idea. If the person who saw it, let's say randomly one of us sitting here stumbles upon the idea, he can also decide to pick it up and do it on his own, right? That's sort of the thing. And Amit, unless you want to add something, I think that's about the answer.
So what I happen to come over to this event, the mental health event that we are hosting, just by accident, purely because I happened to chat with Asif and he mentioned that, hey, this is what is happening. And already I can see there are so many beautiful ideas, the SoulUp one, the Sukoon one. And for example, you were mentioning that there is a need for localizing the assessment part. And I heard from others that Sukoon is partnering with somebody while rolling out in Maharashtra and Assam who will take care of the assessment, who apparently are known to be pretty good at it. So probably there is a bit of connection over there. So the coincidental connections that one person can help out with another one while listening to just fortuitous coincidence of two ideas. Then the second part is the discovery of ideas. A lot of time people are driven by different purposes. Sometimes people are just genuinely have some time and want to help out, but they do not know where to start. Like again, SoulUp, you were mentioning that some people in mental health, they do not even know whether to have a problem or not. Is this a real thing? Similarly for business problems as well, right? So people probably would not know where to start. It's difficult to start from a blank page. That's why this garden of ideas, this kind of meetups and everything. But these meetups being physical, they have their limitations. We want to encourage this similar kind of serendipitous interactions, the fortuitous coincidences, etc., but in a more scalable format, both from the contribution point of view as well as the consumption point of view. So a lot of times people have some real problems. They do not know, they're not trying to solve for, they're hoping for a solution. And then there's a lot of people, the other side of the table, who are looking for a problem to solve. We try to bring them together. This is kind of a physical platform, this being an online version of it. So that's kind of the idea.
Thank you so much for coming, everyone. I hope this session was informative. And I believe there is food and drinks upstairs. But let's continue the conversation upstairs. Thank you, guys.